All right. Hello, everybody. Welcome to episode 9 of Interoperability Unlocked. If you're new here, I'm Courtney Baker. I'm the marketing manager here at Commonwealth and always joined by Liz Lewis, our director of product. Again, if you're new, Interoperability Unlocked is where we kind of chat all things interop and sort of the cross section between data and trust. And today we're super excited to have a special guest. We have Jason Sherwin of Clear. Jason, do you want to give everybody a brief overview of Clear and introduce yourself?
Yeah, absolutely. I'll start with myself and then I'll talk about Clear. I'm Jason Sherwin. I lead business development for our healthcare vertical at Clear. I've been at the company for just over 5 years, helping bring Clear from what most folks know of it as, the airport
Yeah.
security company to healthcare and many other industries that we're working in. I have 15 plus years of healthcare experience. Prior to Clear, I worked at NYU Langone Health for over a decade. So I helped deploy Epic across their enterprise over a number of years. I built and ran their virtual health product before and leading up to and through COVID. And so it was a very unique opportunity to join Clear. I saw, an opportunity to take, my experience in healthcare and identities. There are tremendous challenges around it, which I know we'll talk about in a bit. And I thought that Clear was uniquely positioned given its brand, given the ability to power an interoperable or reusable identity across healthcare. And so, joined the company in 2020 to help scale our business. Just because you asked about Clear, just to touch on Clear quickly, as I mentioned, we're best known for what we do in the airport, but we've really been focused on powering trusted, safer experiences for consumers across their daily life. And so over the past few years in particular, we've built and scaled our platform business. And we're doing a lot of work in healthcare, but also working with large brands like like LinkedIn, for example, the Home Depot, T-Mobile, really, focused on streamlining consumer experiences while also improving one important thing you said, which is trust and safety in those experiences.
Yeah, that's fantastic. And we work closely with you, but we're not, as close as, we're not like a client of Clear's, and Clear's not a member of Commonwealth, but because our members, specifically in the identity and patient access space, rely on Clear's technology, we've sort of become friends, if you will, like in the industry with shared goals. So, I mean, we, in a nutshell, the way that, this works here at Commonwealth is, and across the various frameworks, is entities like Clear are required to be used for identity verification for patients or consumers to be able to query the network to access their own data. So while we're not directly linked necessarily today, we do, work in collaboration with our shared clients, if you will, to make the dream of patient access a reality. I wanted to touch a little bit on identity management just from my perspective, and then we'll jump into a lot more from your perspective, Jason. But, when we think about clinical data exchange at a national scale, in the olden days, it still happens today, but there's a lot of point to point connections. And so point A and point B know each other and have a contract with each other and trust each other through that contract. And that process of contracting and building can take a long, long time and can be very expensive. Insert Commonwealth and similar organizations to Commonwealth, of which there are several. And, that direct A and B relationship, doesn't exist. It exists through the shared alliance of Commonwealth. And the contracts are still in place and the requirements are still in place, but knowing A and B very closely is difficult. And then when we insert the consumer into the conversation, there have been many, many conversations over many, many years about how can I trust that I am who I say I am so that I can query and get my own data. And there's kind of two ways that we think about this. There's the identity verification of me proving that I am Elizabeth Lewis, and with former names that I've also had, right? And then, patient matching, between the systems that are, so I want to kind of segment those two things out because sometimes in this patient identity conversation, in industry events and different webinars, these two things can be conflated. And so I want to make sure that we're, really focusing in on the, identity aspects. And of course, we can touch on patient matching too, and just kind of get your perspective on that. But so that's just kind of like the foundation. And I think we've been really successful in advocating for patient access, leveraging identity verification solutions like Clear. So we're really excited to have you here and learn more with you. So I guess tell me a little bit more about, from Clear's perspective, like where is the industry with identity management and how does Clear fit into the landscape? Because I am a Clear user, but I was a Clear user through travel, mostly because like I was in the Atlanta airport and there was no way I was going to get through security if I wasn't cleared. So tell us how like Clear fits into the equation a little bit more and about the identity management pieces of that.
Yeah, absolutely. And first of all, Liz, thank you for being a Clear member. We deeply appreciate it. So look, I mean, from our perspective, the first thing I'll just say is we've been operating in a zero fill environment in the airport for over 15 years. And so when we think about, where we can drive the most value, it's in other, regulated industries where you cannot get identity wrong. And I would actually argue that in healthcare, that bar is actually higher in many ways in the airport. Yeah. So, airport lobbies and emergency rooms actually have quite a bit in common when you think about it. You have different, stakeholders who are entering those lobbies, if you will. So at a health system, you've got your patients, you've got your workforce members, you've even got visitors and vendors, right? And so each of those individuals today, like the experience is highly fragmented. So you may use a knowledge-based authentication technology to create your MyChart account, for example. But then you also happen to be a workforce member at that institution and you're using a call center to reset your password. In some contexts, you may even be a visitor entering, the hospital and being asked to, share your driver's license every single time that you enter the building. And so it's frankly a highly fragmented process today. Many different vendors. The identity is not reusable, which is a challenge both from a consumer experience perspective, but also from a cost perspective, right? So when you think about the fact that we're relying on, call center agents, for example, to spend, on average 2 minutes verifying who I am before they can schedule my appointment, and that we're relying on the front desk, for example, to verify who I am, scan my driver's license into the EHR. So it's a highly, fragmented and highly administrative. Like it's a very high administrative cost of doing it, right? We spend the last I checked, roughly $4 trillion on healthcare in this country annually, and roughly $1 trillion of those dollars is on administrative costs, and much of that is due to registering patients, moving data around, et cetera. And so we think about identity as the foundation, right? So imagine if you are that same health system I'm referring to earlier, and you have a technology like Clear, and we're not the only one. There are others in the space that are reusable networked identity like us, and you can effectively if you're a patient, a workforce member, a visitor, you can reuse that identity across different experiences. From a technology perspective, right, the way that works is that we have our platform is fully integrated into the technology that it needs to live in for that flow, right? And so one of the challenges around all this from an infrastructure perspective is integration, right, and making it really seamless to the consumer, wherever it is that they're sort of navigating, to make it very simple for them to verify. And so, for example, one of the exciting things that we've worked on with Epic is, as a part of their Toolbox program, they're actually natively building Clear into MyChart, right? So we can streamline the experience for a patient creating their account or resetting their password, for example. And what's even more exciting about that is that they can effectively reuse that same identity. Let's say they present at the clinic and there's a kiosk where they're checking in. You can reuse, the same your same face, right? You've only got one to check in, and ultimately streamline that experience. You're not having to walk to the front desk to hand over your driver's license, scan your insurance card, and so it's really freeing up in that context the patient to have the best experience possible. But also, frankly, freeing up the workforce, right, to focus on, more important tasks like, acting more as an ambassador for that patient as opposed to some of the clerical work that they take on today.
That's fantastic.
Yeah, absolutely. So you were just talking about Epic specifically. Does Clear handle patient matching like across disparate systems and organizations, or how does that work?
Yeah. So think of what we do as it's not just identity, it's identity and consent. And what I mean by that is we're not just verifying that Courtney is Courtney.
Hmm.
When you go through our IAL2 flow, for example, which is a federal standard, and there are a handful of companies that offer this, and it's actually what unlocks a TEFCA use case, for example. It's actually mandated in TEFCA. Um, we are required at a high level to take a selfie, and we run liveness detection to make sure that you are actually a human being in front of the device and you're not a deep fake. And then we're asking you to scan a government ID, and we're not just validating that the ID is active. We're actually going out and pulling from public records, et cetera, Courtney's legal name, date of birth, last known address, for example, phone
Hmm.
number, et cetera. And so tying it back to identity and consent, you are consenting to sharing your verified demographics with a third party like Wellstar Health, for example, which is one of our partners.
Yeah.
And the reason that that's valuable is today you think about the way an account is created at a health system, right? Like I mentioned before, it's like a call center who's typically creating that account. It's all self-attested data. So we've actually found that when we work with a health system, we see over a 95% match rate when we pass our verified demographics to the care system. And we've even gone a step further. We've actually been able to eliminate roughly 95% of the duplicate accounts that could come through our flow. So we had a recent example actually of a patient who was, linking their account prior to checking in at the clinic, and we flagged 9 potential duplicate records in that organization's Epic
Oh
instance.
my gosh.
And they were actually able to clean up those dupes, right? So you all, I think
That
you
is
guys,
huge.
the broader audience, today it's a very manual back end. It means like your insurance claim gets denied. There's obviously a significant
Yeah.
clinical impact in terms of a provider potentially missing a lab result that you may have had on your old record. And so that care system was actually able to merge all those records in advance of the visit, which, streamlines their experience, provides a better clinical outcome. And more importantly, for the care system, reduce costs.
Yeah, that's huge. Because in our world, in interop and exchange, we wouldn't be able to exchange data for that human because there would be likely 9 different
Yeah.
potential matches. Therefore, the response back in the query would be no match found because it's either like a 1 or 0. So that's huge. That's really
100%. The other thing I'll just add is that when you go through a flow with Clear in an organization, we also establish what's called a link ID. Think of
Mhm.
that as a reusable enterprise identifier about Jason as he navigates throughout that care system. So not only are we helping reduce like the duplicate and improve the match at the front end, but we're also binding my Clear identity to that care system so that the next time I come back, you're completely eliminating the potential of a mismatch.
right. That's
Yeah.
fantastic.
So how do we find the right balance between like strong identity management and like ease of access for the patient and their provider?
Yeah. So the way that we think about the world, right, is we are oftentimes user experience or friction, user experience and security are sort of at odds with one another,
Yeah.
right? You can't have one without the other. And for us, we really think that we help create a more secure experience with less friction. And the reason we're able to do that is that we've built a network of over 30 million consumers who have already verified on Clear through some channel, whether that be the airport, whether that be LinkedIn or the Home Depot, for example. And you can reuse that identity credential, all of which is tied back to your selfie,
Mhm.
to be able to verify that you are who you say you are. So for us, it's about verifying who you are in that moment, right? This is Jason with liveness. This isn't a deep fake. So securing that experience, but also reducing the friction. So a couple of examples, right? Just to, make this real for folks. So, Liz, you mentioned that you use Clear, at the airport in Atlanta. You may also you need to pick up a piece of rental equipment for your, weekend home project at the Home Depot. You can just verify with a selfie on your smartphone with Clear and actually pick up that equipment. And then you may need to consume care at a Wellstar Health, for example, and you may be checking in at the clinic there. And the beauty is, again, you're just, we're just integrated into that experience. You're just taking a selfie to verify that you are in fact still Liz, and we can effectively, let you in, or the care system can let you in to that experience. Another example that just this isn't just about patients, right? This is also about workforce. So We announced a partnership last year with SureScripts, and they've actually gone so far as to mandating IAL2 across their platform for any prescriber who's accessing their system. And so with SureScripts, if you're a provider, you verify with cleared IAL2, and then you can reuse that same credential if you're, for example, resetting your password at your local care system. So this really is about the network effect and making it really simple for you to verify that first time and then effectively, reuse that credential across our network.
Amazing.
That's amazing.
Yeah. Getting more into the nitty gritty of how our two worlds kind of collide. How can identity management support TEFCA? And you were just talking about SureScript, so QHINs in general, and just like national interop, that whole landscape.
Yeah, so there are a few things to talk through here. So one is that IAL2 has really become the gold standard for US healthcare. And IAL2 is a federal standard governed by NIST, and we actually have to go through a very robust auditing process every year to maintain that certification. What's great about that is it's a federal standard that any organization can invest in, right? So we're not the only one. There are a handful of others, and there are private companies like well, we're actually publicly traded, but there are private sector companies like us, and there are also like federal platforms like login.gov, for example, who've invested in that. So we love that because we can give consumers choice, right? We don't want to be the only option. We're a fully opt-in platform. Importantly, Clear doesn't sell or rent user data, which is very different than some of the traditional players in the space. And so choice is important to us. So that federal standard is really the foundation. And what's exciting is healthcare has really been a leader in this space. So IAL2 is specifically called out in TEFCA, right? And so there are two ways to access your data. There's log into my 10 or 15 different patient portal accounts, or verify once with IAL2 and use the verified demographic information to pull that comprehensive record off of an exchange like Commonwealth, QHIN specifically. But this is also something that's being adopted in other parts of the industry, right? So EPCS for controlled substances for providers, for example. The Joint Commission just last year actually announced that they'll support IAL2. So no longer does a physician have to go in person to identity proof to meet the Joint Commission's requirements. They can just use a technology like Clear to verify. And what's most exciting is some of the recent commitments that CMS made as a function of the recent RFI that they put out, where they actually committed to investing in what they described as modern identity verification on Medicare.gov. There was a recent, and this is public, there was a recent incident where roughly 100,000 Medicare beneficiaries were notified that a bad actor had actually spoofed their way into their Medicare account. And so you can imagine how that IAL2 credential could have reduced the fraud in that instance. And then again, allows you to reuse it for an individual access use case, for example, on TEFCA. So I'm particularly excited about the direction that CMS is heading in, because in many ways they're helping, set the floor and help invest in, building up that network of IAL2 proofed, consumers, and then being able to reuse that credential for other use cases across, a broad swath of healthcare experiences.
Yeah. I think for us, we have such an opportunity to begin to leverage, this identity credential across the space as well. And to say, I, can trust that this is, from Clear, I can reuse this as we sort of move patients throughout the healthcare ecosystem. I think there's a lot of potential for even expansion, even just for, our little piece of the identity puzzle, as you sort of outlined. I think for us, this is really exciting because we also have invested a lot of just time and energy and research over the course of many years. We, originally supported this use case back in 2016. And at that point in time, we didn't have IAL2. We had sort of like a previous iteration of it, level of assurance. And it's since evolved, and with this certification that you were talking about, has sort of allowed us as well to point in our specification to this is the minimum bar. And it's not without pushback. it's not without challenges, but what it has done is it has enabled a significant amount of our provider community to say yes to consumers accessing their data securely through Commonwealth. And I think you really hit on it in your examples of removing friction, removing burden from, we can call them consumers, we can call them patients, we can just call them humans and their day-to-day life, kind of regardless of where they are, whether they're seeking healthcare, like you said, going through the airport. We have notification fatigue and to-do list fatigue, and removing one less thing and allowing technology to handle that for us, I think is just fantastic and opens up a lot of opportunities, and I think we'll continue to do so.
Yeah. Out of curiosity, who is responsible and who pays for the identity management infrastructure and like the governance of it?
Great question. So a few things. One is that so in the airport, we're a direct-to-consumer product. Folks are paying for that experience.
Yeah.
Everything that we do outside of the airport is completely free to the consumer. And this is hugely important to us from a health equity perspective, right?
Sure.
We want to make sure that folks have easy, free access to this. So, for example, we work with HealthX in New York State, and any New York resident, there are roughly 20 million, if I can remember correctly, can access the portal that HealthX has built and use their their free clear IAL2 identity to access their comprehensive information. So that's been hugely important to us. In terms of how we, how we stay in business, we work with, our B2B partners. So, for example, take a health system. We're helping drive operational efficiency because we're reducing call center calls. So, Community Health Network, for example, we've helped reduce call center calls by 54% for patients creating their MyChart accounts and resetting their passwords. We're helping reduce fraud, right? So we're helping, communities also using Clear for their workforce members. They have over 97% of their employees on Clear, and they're using Clear as the required option, as a requirement to reset your password, right? So we're helping streamline the experience, reduce call center calls, reduce fraud. We're helping drive operational efficiencies in the clinic, so helping eliminate the need for the front desk to have to take my picture or scan my driver's license because we've already verified that information in advance. So it's really about driving more efficiency, improving the experience, and most importantly, unfortunately, in the environment we live in, reducing fraud, because bad actors are finding ways more than ever to get through and ultimately, compromise either a workforce member's credentials or, in many cases, even a patient's credentials as well.
Yeah. Totally. I mean, I think that's super important. I think kind of forward looking and building.
The last thing I'll just mention, Liz, sorry to cut you off, is what's exciting about what we do is that because we are a networked identity, our goal is to democratize identity. What I mean by that is as we bring more consumers onto our platform, we have over 30 million today, as I mentioned earlier, we can actually reduce costs for the entire system. So we effectively can amortize the cost of Jason's identity on the Clear network across all of our partners. So over time, our goal is prices go down, not up. And I think the incentives are very different for some of the traditional ways that we verify identity, where it's more of a transactional sort of bespoke point-to-point experience. And our focus, again, is being that reusable identity that is sort of the foundation for the entire healthcare journey. And in that context, we can really drive reduced cost, which, given some of the macroeconomic pressures, particularly at the federal level, that's hugely important in today's climate.
Yeah, across healthcare writ large. Yeah, absolutely. So I guess what I was saying is kind of forward thinking, how do you see this expanding into kind of whole person care across not just your traditional healthcare settings? And this is something that within the national network space, we're talking about as well with, other types of community-based services, behavioral health, free healthcare clinics, non-covered entity type of organizations that still serve the patient or serve the consumer in some sort of health, way. How do you see, just crystal ball, how do you see this progressing, and where do you think the opportunity is there with regard to identity?
Yeah. So I would say, as we continue to build our network, right, we can make it easier and easier for organizations to effectively turn us on, both from an integration standpoint, where we've invested deeply, not only in Epic, but for example, with a care system, it's a lot of the identity and access management systems that they leverage, like an Okta, for example, or a ServiceNow for the call center. Specifically to your question, Liz, I think meeting the consumer or the patient in this case where they are is hugely important. So tying back to my health equity comment earlier, you can't only just verify with Clear with your smartphone, although most if not most Americans have access to a smartphone at this point. The data is actually quite staggering there. But what's important is that we also want to provide other ways for you to verify. You can go to the airport, for example, and do that obviously through we're a certified reseller for TSA PreCheck. So we've now launched it over 100 retail locations across the country, including Staples, for example. From a product innovation perspective, one of the things we're focused on is how can we actually enable the healthcare staff and the clinics to serve as a Clear ambassador to effectively enroll that patient in the platform for the first time. So that's really been a core focus for us. Because ultimately we want to make this available to, as many consumers as possible, especially again, from a health equity perspective.
Yeah, absolutely. I think we're sort of in a similar state where we're thinking about, how do we ensure that some of the most underserved people in our population are not left out from the discussion, since a lot of what we've done historically has been focused on kind of the bigger players in the room. And that's fantastic. And they're here and they're getting connected and they're leveraging technology services like what, both of us offer. But there's a long tail that I think that, we want to make sure that we're not losing sight on. So, I mean, I have spoken with you many times, but I've learned a lot today, which is fantastic. I think, from our perspective, it all kind of links back to the core of why we're here, which is trust, and making sure that we can trust each other. I'd also be interested in, we're having this kind of debate inside of the TEFCA space around, licensed healthcare providers and their use of the network, even if they are not employed by a covered entity, and how, some of the HIPAA privacy rule requirements are not applicable, but how do we trust them and how do we trust that they are who they say they are? And I think that there's an opportunity there as well for some, identity credentialing as evidence. So it's a possibility to expand even to make sure that we don't limit access, but that we can ensure, that there's, we're all trying to avoid bad actors who are continuing to try to, infiltrate all systems at all times. And, sometimes they're successful in doing so. So, okay. So I know, Courtney, you want to do rapid fire as we wrap up, which is fun.
Yeah. So to close us out, one last question. As you kind of look to the future of identity management, what are you especially excited about as far as like innovation or advancements in that space?
Yeah, I think for me, it's, we don't just, and I sort of spoke to this earlier, we don't just think about identity as what's on your driver's license. We think about it as identities with depth. So today, right, you may use Clear to create your MyChart account, for example, or access your health records, from a Commonwealth like use case off of a QHIN. But tomorrow, where we really want to go is how do we start to add more credentials that make you you? So, for example, take health insurance, right? How can we bind your driver's license, if you will, to your insurance? And we've actually partnered with a company called Nirvana that can do that, so that when you're scheduling your visit online, for example, you can share not only that you are who you say you are, but also your insurance. Payment is another really interesting area for us. So when you think about like, what are the three things you have to pull out of your wallet when you check in at the doctor? It's your license, it's your insurance, and it's your HSA, FSA cards. How can we help, and how do we enable you to leverage those HSA, FSA dollars, because so many of us don't. And then, even bigger picture is how do we, and this is where you guys are providing such amazing value to the community, is how do we, enable a consumer to access their comprehensive healthcare record so that it can make it really easy for somebody like me who moved from New York to Boston a few years ago to not have to fill out the same information over and over again on clipboards. I should be able to, share my allergies, my family's complicated cancer history, my preferred pharmacy, all that information with just my face. So that's what has me most excited, and what has kept me at Clear for over 5 years.
Yeah, absolutely. So, Liz, given what Jason just shared, what do you think this will do for trust among the whole interop community?
Well, I think it's already doing what
Yeah.
we had wanted it to.
Yeah.
And like anything in technology, I think that we think and we can think and build fast when it comes to innovative technologies, but the adoption and education and just like knowledge sharing about why this is important and what impact it has and the stories that we share are, is the the road that we're on and that we'll continue to take and continue to have conversations like this because um you know sometimes the work that we do gets very deeply embedded into kind of the more technical conversations and we want to continue to bring to light that this is happening, it's working successfully. We have a partner, a member of ours who leverages Clear, who is certified on our network for consumer access so that consumers can query for their own records, and we've demonstrated this at HIMSS. We used Clear's technology, in a recorded demo with a real human being in their face, like taking the selfie and showing that this can work. It can work securely. They can get their own data back. And we leverage, the information that Clear validates to use to find the right patient's information. And if it's fuzzy or we're not sure, then we're not going to, move forward with that transaction. But in the cases when we have a really high certainty that this patient who has been identity proofed matches patients on the other side, then we're able to move that data. But I think that, the ball's already rolling in the right direction. We've seen really positive feedback from a lot of people out in the interoperability space. And I think that that will just continue to grow. So I would just say, thank you, Jason.
Well, thank you guys. Thank you for having me on today. And Liz, obviously we've been collaborating for years, and we have a huge opportunity in front of us to, the technology, to your point, is all there. Unfortunately, 90% of technology is people and process. So we're bringing everybody along for the ride, but it's an exciting moment, and we're ready to scale.
Yeah.
Is there somewhere we should have listeners go to if they're looking for more information, Jason?
Sure. Feel free to reach out to me on LinkedIn if you want to talk personally. I'd be more than happy to and geek out with you. And then you can also, if you want to find more general information, you can just go to clearme.com/healthcare. There's a lot of good info on our website.
Amazing. Perfect. Thank you again for joining us. Everybody will be back in 2 weeks, Thursday at noon Eastern time, and we'll see you then.
Great. Thanks, Jason. Appreciate your time.
Thank you.